Welcome back. Tooth decay and heart disease may seem unrelated, but studies show that they are. That's because the bacteria that is present in the dental plaque can cause blood clots in the arteries. Wow, this is really something, huh? When these potentially fatal blood clots are released into the bloodstream, they can induce heart attacks. Now, just like me, you may be asking, what? Now, to tell us more about the connection between tooth decay and heart disease, we have with us this morning Drs. Ron Rosero and Dr. Sunny Burias. Guys, good morning. Doctors, good morning.
Good morning.
And
thank
you for joining us. I think literally when I first heard tooth decay and heart disease have a correlation to one another, I was thinking, that seems quite far. What? Please, very basically, tell us, how is that possible?
There is really a correlation between tooth decay and heart disease. As a matter of fact, there have been a lot of researches that show that there's a connection between tooth decay and heart disease. Just to elaborate this, tooth decay, or we call it dental caries, is a disease of the teeth, and which finally results in the damage of the teeth. Now, tooth decay is caused by a bacteria which is found in dental plaque.
Okay.
Plaque is a thin film of food debris, mucus, and dead cells that clings on the tooth and the gums, and it serves as a medium for bacterial growth.
Okay.
Now, this bacteria extracts sugar from the food that we eat and converts this into lactic acid and store this in the cavity of the teeth.
Okay.
Now, the bacteria that is present in the dental plaque can cause blood clot in the arteries.
Okay, that's, I guess, where I'm just going to stop you very quickly,
Yes.
Doctor. When I think of myself getting plaque or any sort of bacteria in my mouth, I mean, I just think that's from, you know, things that you eat, I mean, food that you eat, drinks that you intake, but it still doesn't really connect with me how the plaque around the teeth and the cavities that I might get because of too much candy actually leads to clots. How does that work?
Okay, so these blood clots, when they release, okay, when they this potentially fatal blood clots are releasing the bloodstream, then it induces heart attack. Now, the clot, the formation of plaque on the gums, lead to a chronic inflammation of the gums, and also it causes inflammation of the blood vessels. So that's why this plaque, the accumulation of this plaque in the arteries, now can induce heart diseases.
Okay. All right. Okay. Well, I think maybe the visuals will also try to help us. How do we know? So now if we look to see the health of our teeth, that's actually a reflection of the health of our heart? I mean,
yes, and that's exactly
very basically.
This is why if a patient, an individual who has a severe dental decay or tooth problem or gum problem, most of the time this patient have signs and symptoms of heart problems.
Now, is it possible that you can kind of work the other way around and say, take really good care of your teeth, and reduce heart disease? I mean, I know that it goes one way or the other, but can you actually flip it around and make taking care of your teeth and your gums helpful in reducing heart disease?
Of course, it can certainly lessen the chances of heart disease if you have a healthy mouth, if you maintain your teeth very well, and if you visit your dentist at least twice a year.
Now, tooth decay, when you think of things that are decaying, I mean, you really think that it's in pretty bad shape. What are some early signs that that people can kind of look out for to know that they are very susceptible to tooth decay, or that they may actually have tooth decay already?
Well, actually, it's hard to detect tooth decay at first, at least for the layman. That's why you have to go for checkups. But the first sign that's usually noticed is a toothache, but then that's already when there's a progression of tooth decay. Another sign would be discoloration of the teeth, either black spots or yellow spots or even brown spots. And then, well, if you start to get sometimes severe tooth decay, it can cause fevers and swelling of the face. I'll give you an example.
Now, what's the time frame that you're looking at when you start to see some symptoms of tooth decay? How much time do you really have, or what should you? I guess the time frame that you're really looking at before any heart disease can progress.
Well, go ahead.
Yes, it actually depends on the health of the person, because normally if a person is not that susceptible to heart disease, if they maintain a healthy lifestyle or they just don't take care of the teeth, then there's lower chance of getting heart disease because of the teeth. But if you like to indulge in, well, cholesterol-laden foods and then a lot of sugars, then that's going to increase the chances for heart disease at any time.
Okay. Is it okay? We're seeing some we're seeing some visuals of cavities. Can we go through and maybe talk about how it actually does happen? We're seeing the cavities kind of take its toll on the tooth right now. Is that what we're seeing? And then from there, how do we go from it breaking down the tooth to heart disease?
I would answer that question. Now, the lactic acid that is formed in there and the bacteria that is in there, which we call it Streptococcus sanguis, can cause a blood clot, and it can now transmit to the blood vessels.
I see a blood clot within the mouth.
Within the mouth.
I see, okay.
It transfers and it releases into the bloodstream. And once it releases into the bloodstream, it accumulates in all the blood vessels and causes heart problems.
There you go. Okay, I'm sorry I didn't make that connect earlier, and it does really very much help with the visuals. I mean, little by little, it does take its toll. You can accumulate that many blood clots in your mouth with tooth decay that it can clog up your arteries.
That's correct.
Wow, okay. What's the age frame, doctors, of people who should really start to be wary of tooth decay and heart disease?
Well, it doesn't really choose an age, because sometimes, even if you're young, you have a heart problem from the outset. But then, usually when it's 40 and above, you should start taking even better care of your teeth, because not only do you have less saliva cleaning your teeth, you also have had a lot more time for the plaque to form, for the bacteria to accumulate, and for heart problems to set in.
Okay, we just saw something also about. Now, is this a solution? What we just saw. If you're 40 and you feel like you are someone who has tooth decay, or you've been diagnosed with tooth decay, what are your options?
The best thing to do here is to, of course, go to the dentist for regular checkup, and then to do a lot of to do the restorations and restore whatever the cavity is, and then that would prevent, of course, accumulation of lactic acid inside the cavity. So that's one. The second is to make sure that the gums is healthy also. So proper cleaning, okay, proper oral care, and then also regular dental cleaning is a must. Especially at the age of 40 and above.
Now, if the blood clots are seen within your mouth, can you actually get dental surgery? Can you go through the steps where those blood clots can be? I don't know if that's a question that's totally impossible, but how do you take care of those blood clots? You know, I'm kind of thinking if you have blood clots in other arteries or other parts of your body, you can get surgery. Can you do that as well?
Actually, you won't be able to see the blood clot in the mouth.
Okay.
It's released inside the bloodstream. Slowly by slowly, it accumulates inside the bloodstream, and then it attaches to the blood vessels. That's where heart attack comes.
Okay, okay. That's really something that's quite interesting. I just need to. Sometimes you really take it for granted. I mean, you eat poorly, and you think that you're only doing detriment to one aspect of your lifestyle, but really you could be doing a huge disservice to your heart health, the health of your heart.
General health, actually.
Okay. Before we have a storm of people run to their dentists to make sure that they are okay, what can people do on a day-to-day basis to really ensure that the plaque is not being built up?
Okay, essentially, watch your sugars. That's one of the main causes. The sugars are converted to lactic acid, like Dr. Boris said. Also, don't just brush. Brush properly. Brush at least 10 minutes a day for each time you brush, and then floss and use a mouth rinse. Also, visit your dentist regularly. Skipping that is the most dubious thing you can do for your teeth.
That's every 6 months.
Every 6 months, ideally.
6 months.
Okay, and just because we do have these very cool things that that will demonstrate. You mentioned a step-by-step process. You said definitely brush properly. Do you have a way that we can kind of show our viewers the proper way to brush, doctors?
Well,
sometimes it actually becomes very simple as brushing properly, and sometimes you're in a rush, you're on the move, and you don't realize that you're not brushing at all. Basically, you're just going through the motions. Go ahead.
That's exactly what we mean. Take your time in your brushing, because you can brush as fast as you want. You think it's clean, you press hard. You can actually damage your gums. But if you take your time, it's how long you brush. It's not how hard you brush or how often you brush, but how long you take for each brushing.
Okay.
So get all the surfaces of the teeth, the top surfaces, and then the sides.
Okay.
Because essentially, when you brush upwards, for example, or downwards for your upper teeth, you're pushing some of the debris out of your gums.
Okay.
So that helps in preventing any tooth decay from forming, since there's no food there.
Do you want to pay particular attention to your molars, or the back where I feel like you can?
It's easy to accumulate plaque there, especially since it's in the back.
That's what my dentist says. He knows exactly what I've been eating when he's cleaning the back of my teeth. Okay, so you want to pay particular attention to that. And how long is proper brushing? I mean,
proper brushing?
5 to 10 minutes would be fine.
Yes.
5 to 10 minutes, that's a long time.
It's a long time. It seems like a long time, but it's worth it in the long run. Trust me.
Okay, and then as far as so I also want to ask very quickly, it's brushing then flossing, or is it flossing first and then brushing?
Brushing then flossing.
Brushing then flossing and then mouth rinse.
And mouth rinse.
Yes. Okay, and then go and see your dentist twice a year.
Twice a year.
Any final pointers? Anything that you doctors, Dr. Sunny and Dr. Ron, would you like to add?
I would just say, if you want to have a healthy, or if you want to stay away from tooth decay and heart disease, okay, pay more attention to oral health care. And healthy teeth means healthy heart.
That's a wonderful thing. I mean, that's just as simple as it is. Doc, anything else that you'd like to add?
I agree with Dr. Sunny. Always visit your dentist regularly. That's most important. There are so many dentists out there who know how to take proper care of your teeth. And so many people just rely on the quick brush, and that's it. Sometimes it's not even enough to remove what's necessary. So visit your dentist twice a year for cleaning, for a checkup, and
don't be afraid of the dentist. Sometimes you really just kind of take it for granted.
Exactly.
That's correct.
Well, Dr. Sunny, Dr. Ron, thank you so much for coming in and telling us about tooth decay and heart disease. You guys are really making me want to go see my dentist sometime soon. Very quickly, sorry, last question. Foods to stay away from. Outside of your candy and your sugar, any things that are kind of silent sugars?
Rice, bread, anything which has carbohydrates,
which can accumulate more plaque to your teeth, especially to the gums. So we have to stay away as much as possible.
All right, and see these guys more often in the year. Thank you guys once again, Dr. Ron and Dr. Sunny. Thank you.
Thank you very much.